people listening to this, I would hope, no matter what your need is, probably within home care somewhere, we've got a way to meet the needs. We act as that fiscal intermediary so that those consumers can drive the care. They can make sure that they're getting someone to do what they trust, what they love, and work through that. And then we support them all the way through that. So again, I think it just goes back to there's so many different options and you can pick and choose and make it work for you.
Welcome to In Good Company, Elder Care in Your Backyard, the podcast that brings local perspective on aging, caregiving, and healthcare right to your ears. I'm John Ray.
And I'm Spencer Ernst. Every week, we talk with the people on the front lines, all making elder care accessible to you.
Welcome to In Good Company, the Elder Care podcast, where we focus in on everything elder care. In my personal life, I had lots of issues with the elderly in my own family, and I saw this as an opportunity to try to get information out to people so they can put together a plan that I didn't have for myself and my family. And so I want to try to bring all of the complexity and issues to bear so that people have some good starting points to start difficult conversations. And again, putting things in place that are going to help protect someone's wellness, advocate for people, and protect their assets.
And quite honestly, a few years ago, the passing of my grandparents back to back was really tough on my family. It took a toll because we had so many questions when it came to elder care prior and hospice. And, my mom was working as a caregiver at that time. And there were big questions. Should we put grandpa in a home? Should we not? And the whole power of attorney thing was also very confusing for my family because it caused a little bit of a rift. And when grandpa passed, at least from my mom's side, it took a toll on everybody. And having a resource, having someone there, an advocate to help you through that would have been so beneficial for my family only a few years ago. And so we're really hoping that this podcast can really help answer some of those questions and help your family through all of it, from elder care through hospice.
Kim Sisk, Administrative Director of Home Care Services at CoxHealth at Home, brings over 22 years of experience in the home care industry. She has also served as an executive director at Oxford Healthcare, specializing in in-home services and consumer-directed services. Based in Republic, Missouri, Kim has dedicated her career to enhancing patient care through innovative service delivery and operational excellence. Kim, welcome to our podcast.
Thank you. I'm super excited to be here. I've been looking forward to this for weeks now. So yeah, I'm excited to be here. Thank you.
We are so excited. We've known each other for a long time, Kim.
We have known each other for a long time, but worked on a lot of different things over the years.
Yes, we have. Well, I am so excited. We have so many great questions for you. Let me start by just asking you about your current role and what you're doing with CoxHealth Systems.
Okay, so my current role, I'm the administrative director for CoxHealth at Home, and we're divided sort of in two separate legs. So there's the durable medical equipment side, and then there's the home care side, and that's where my skill set lies and my team lies. So on that side, we talk home health, hospice, private community-based services, palliative care, all of the at-home, really direct care, personal services that fall under that umbrella. So have great teams and love it. So I've been with that group in some capacity over 25 years. So long time. I know, started really young, right?
And what role did you start with?
I actually started in the Joplin area, and I was a regional supervisor for the private community-based side, or the in-home services program, and then transferred to Springfield. So it's been, a lot of great mentors over time, and you learn a lot and just grow with it. So it's been awesome. Great.
Do you know a little bit about the history of Cox?
I do know a little bit about the history. And I love that you asked this question because Cox Healthcare is very locally and community driven. We've talked a lot about that over time. And so over 100 years ago, Ellen Berg was a Springfield person, very committed to the community, and she donated her house for the hospital at that time. And it was, let me make sure, Deaconess Hospital at that time. And so it started to financially struggle. And at that point, Lester E. Cox who we all know and love. But he at that time jumped in and was very active to help with that hospital and getting them up to speed and financially viable. And so that partnership grew over time into what we know as CoxHealth today. So about 500 employees at that time, now to over 14,000. But I think even with the growth that's coming that way, you can feel that in the culture of what we do and the grassroots of CoxHealth. So we're all really proud of the history and love that. So, yeah.
What's your geographical footprint?
Yeah. So CoxHealth actually has 25 counties that they connect to. So it's really more of a regional footprint than even just the Springfield area. For CoxHealth at Home, depending on the area, so for the home care, hospice, home health, that's more of the Branson, Monette, Springfield, Webster County, that direct area. But then when you start talking about DME, for example, they're wherever we need to go within that area, home infusion. So there's a lot of our post-acute services that are just an extension of, and we have a really regional impact. So
that's awesome. I can't wait to get into all the other things that you just happened to touch on very briefly. But let me zero in on kind of the main Cox at Home services, which is the home health, hospice, and home care. Can you help us understand the difference between home health and home care?
Yeah. With home care and home health, I think it's a good question because everything kind of gets lumped in, even internally sometimes it's kind of all home health or all this. So I think from the home health perspective, when you talk about classic home health, that's more of a skilled based need. So it's very short term. It's very intermittent. It's not maybe as long term as what we see with some of the others, very prescriptive, very intentional, very outcome focused. And so see that covered through Medicare, through Medicare Advantage, through some of those different payers. And then the home care side, I think of that as more of a supportive type services where they're in the home. Maybe I need that for a longer period of time. We've had patients on for home care for more than 30 years. I mean, it's been a really long time where in order to be independent at home, they need just some supportive care to stay there. So an example, the home health side, maybe someone's had surgery in the hospital, they're being discharged to home and they need just a little while to help with some therapy and a nurse to come in and check or what have you to make sure they can restore back and then they go on about their business. But with the home care side, maybe they're at home, they want to be independently and maybe shopping and errands would help them stay, or once a week, someone to come in with their bath, those kind of things, that's how they differentiate. And so when I talk about those two in that big bucket, I always think that for people listening to this, I would hope no matter what your need is, probably within home care somewhere, we've got a way to meet the need. So that's the thing kind of focus in on.
Yeah. So, and we could spend probably hours talking about home care because there's so many different things within that model. Exactly. But do you mind just touching on a couple of the major things within the home care area, maybe how they get paid and like maybe some of the specialized services?
Sure. So under the home care umbrella, it's sort of a catch-all in a lot of different ways. So there's private pay that we provide, and that's pretty much concierge, whatever you need. We've escorted families to Colorado if they need to do that, just provide care, 24/7 care. So that can come out in a lot of different ways. And then there's the total other end of the spectrum where there are those Medicaid programs like in-home services or consumer-directed services where those are paid for by Medicaid. It's not 24/7, but perhaps a few hours several times a week to come in and do the bathing or homemaker chore. Respite is a big piece. Families are exhausted, and so we can provide caregivers to give them a break. Little bit about the consumer-directed services model where that's kind of unique. Family members, we act as that fiscal intermediary so that those consumers can drive the care. They can make sure that they're getting someone to do what they trust, what they love, and work through that. And then we support them all the way through that. So again, I think it just goes back to there's so many different options and you can pick and choose and make it work for you.
Yeah. And when you say fiscal intermediary, you mean Medicaid, right?
Yes.
Yeah.
Yes. Medicaid.
Yeah.
Yeah.
Very good. So back to home health. Since that's more acute, short term, that sort of thing, what typically qualifies somebody to go onto home health?
Right. So it's pretty straightforward with home health. That looks a little bit different. So from home health, physician obviously has to be the one driving that. So they've had a visit with the physician either 3 months before to say, hey, you've got a need here and we can work through that. So physician recommends, or if they haven't done it at that point, within the 30 days following. So definitely under a physician care, we have some patients who they don't want to go see a physician. And so that's hard to get for home health. And then certainly for, they have to be homebound under home health. That one can be a barrier sometimes. I'm wanting to go out and run around, still go to my job and do all those things, but I'm still recovering. That probably won't be a good match for me. But home health, where it's really taxing for me to get to my car to go somewhere, or I want to go to church and I just can't. I can't even get to my car without being taxed and out of breath. That's what they're looking for with that homebound piece. And then, of course, it has to be provided by a certified home health agency. So I think those are the primary ones there.
Yeah, it's different than hospice in the way the homebound part of it is different than hospice, because in hospice, they don't have a homebound requirement, right? Right. Correct. And they don't always on those other home care services that we were talking about either. Those people, it's a little bit different requirements depending on the payer and what the program is and what have you. So people hear homebound and they think they're literally tied to their home, and they don't know that there's exceptions of things that they allow. Or what are a couple of those exceptions?
Yeah. So if you want to go to church, I mentioned that a little bit earlier, that is an exception. So there's certainly an allowance for that. Sometimes there's just a one-time appointment. My hair is critical. And so that could be an exception where that's a tax for me to get there. And it's not a frequent thing, but that's a one-off. And so there are some very specific exceptions like that. You don't have to be just tied to your chair or to your bed.
Yeah, thank goodness.
Yes, right.
People would disqualify themselves if they thought they could never leave their home.
Exactly.
So we get a ton of questions about insurance, and we've got open enrollment coming next month. And so one of the things that we like to try to help people understand is the different types of insurance, especially under home health, since that's really primarily what we're talking about. Because, and I'm just going to throw this out there just so we can clarify a couple of things. Sure. Under hospice, if you're on traditional Medicare or Medicare Advantage, it all rolls back to traditional Medicare.
Right.
But in home health, it's different. And there are significant difference in how we see that play out. And so what do you see, or maybe some of the differences between those two? Yeah,
I think that's a really important question with how we're talking today. It is extremely complicated. And as families and even individuals are going in to evaluate, there's so many factors that you have to consider. We get a lot of questions along the same line, which is the best for me, or what's the best product, or and there's no cookie cutter answer with that. It really depends on what it is that your circumstance, where you are in your healthcare journey, where you are in your disease prognosis, what your budget looks like, how often do you travel. All those kind of things can really be differentiators, which works. But some things, certainly provider choice is something that we see as a basic. Medicare, that's nationwide. So there's certainly physicians and that sort of thing. There's a little more freedom there. When we look at Medicare Advantage plans, those are usually a little more locked in terms of a network. And so that can be choice limited. For some people, that's fine. But for some, that's not going to work for them. Prior authorizations, that's a big difference between Medicare and some of those other plans. With Medicare, there's pretty standard services that are provided, and you know that. with the Medicare Advantage and or some of those others, there's a sort of a gate that you have to get past or permission before those services are provided. And I had an example. My mom actually had surgery not too long ago. And when she was discharged, her physician recommended that she go to rehab. And but the Medicare Advantage plan that she had, they were evaluating that under a different lens and said, we're not sure that that's where the best care should be or where that should land. So there was just a little bit of a disconnect there we had to work through. But that's one of those considerations, that permission that has to come forward. Certainly coverage with Medicare, that's government run. The others are more privatized. And so that can just take different flavors as where it's not as standardized. There's the co-pays. And then, of course, we talked just a little bit about the travel piece, but those are just a few high level differences between the plans. You may have some additional things to add to that, but.
Yeah, on our side, we do see the authorization part of it, and we do see some limiting of services. That seems to happen quite a bit on the Medicare Advantage side versus the traditional Medicare. But cost does play a big factor for people. And that's why I think sometimes those are difficult choices to make. And they often are like, well, which is the best plan? Which is and that's a tricky one to walk. But if somebody's wanting to go to any doctor, they're not wanting to deal with, hidden charges, so to speak, or they're, wanting to not worry about delays in care or denials of care as much. Traditional Medicare kind of has a little bit better track record, but that doesn't mean that there aren't great Medicare Advantage plans out there for everyone.
Exactly. And I think you mentioned open enrollment, and I think that's a really critical piece, that there's so much to know with all of this. Senior age, for example, locally in our community, if there's questions about that, connect with somebody who can take the time to really walk through those plans, make sure what are those goals of care? What is it that you need to accomplish? What does your budget look like? Where are you in that healthcare journey? And let someone help you navigate that, because there is a lot to know. And there's just no cookie cutter stamp. Here's the right thing to do.
Yeah. And thanks for mentioning senior age. We had Mark Applegate on recently, and he's just a phenomenal resource, but he mentioned so many other additional resources on top of everything that, agencies like ours do, that I just think, they're just a great resource, period.
Absolutely.
They're in it for the right reason.
Yeah, I will sing their praises all day long. Yes, for sure.
Let me shift back to CoxHealth system as a whole, and maybe Cox at Home. You have a whole host of ways of supporting people beyond just home health, hospice, and home care that you bring to bear in order to make sure that you can help somebody age in place. Can you get into some of the detail of, if you have a little more complicated patient, what things you guys can do?
Yeah. So I love that question for a couple of different reasons. One, that obviously kind of back to what I mentioned earlier, that if there's a need, chances are we can take care of it somewhere across the system. So there's a lot of different options there. Certainly from the hospital side, just things for surgical procedures and primary care, all of the things. We do the whole gamut there, and that's continually expanding. So I love that. And from a home care perspective, what I love is the ability to layer and bob in and out of care as the time changes. None of us, our healthcare journey is not static. It changes and it moves. Sometimes it's one step forward, two steps back. Sometimes today you're feeling great, tomorrow you're not. And so I think about even my dad in that perspective and the way that we used home care services as a whole. And so if you don't mind, I'd like to, because I think that maybe highlights that and brings it to life. But what he passed a few years ago, but had cardiac concerns. He had surgeries, those sort of things. And initially, home health was fantastic. That's what we needed. He had those very short kind of episodic issues. He would go home. We would bring in home health. They would get him stabilized, and then back you would go. So that was perfect for a long time. But then as that progressed, he started to fall. And so we were able to then add in a technology for Lifeline to make sure that my mom wasn't there, then someone was able to at least know and be notified. So that was a layer pulled in there. We bobbed back and forth with home health some as things came about. He needed a CPAP. He needed a walker. He needed all the things. And so the durable medical equipment side was able to be tapped in to keep him independent and meet those needs. Little more with home health. Then we pulled in palliative care. The disease progressed and he needed an intermediary, someone just to help him. How do I navigate this disease that's getting more and more difficult? That symptom management, those sort of things. And then eventually we ended up with hospice, where those services are incredible, not just for him, but for my mom who needed it, and for the rest of my family, that spiritual journey, all of those sort of things. So for him, just very personal and up close, that was a way that we were able to keep him at home. He passed at home, and we were able to pull in all of those services and layer him in over time, so that he was able to be where he wanted to be. So that's how what we do continues to just live and breathe every day. And I love it. So
that's amazing. And I mean, it's so neat that you got to see all of the things that you do bring to bear, I mean, you have a direct impact on your own family. That's amazing. We just, as a matter of fact, yesterday morning, we got to meet with Dr. Melissa Gaines.
Yes.
And she talked about your palliative program and the hospice program, and what a great resource she is. And I have to one more time plug the Soft Surrender that's premiering November 1st. So if anybody out there who wants to help contribute to that, it's a wonderful movie. There'll be tickets, I think, are on sale right now. And so we just want to throw that out there. As much as healthcare is a business, it's still very personal.
Exactly. All relationships and very up close needs. It's not from a distance. It is really close. I think that's what sets us apart and makes it really different from any other industry. So, yeah.
So you've been in this industry for 22 years. You've seen a lot, the good and the bad, over the last 22 years. Can you describe what things you are really excited about and think are wonderful that have changed for the better? Anything you might think is kind of going the wrong direction, perhaps you'd like to see change?
Yeah. Over the years, certainly technology has been pretty fun to watch. That is something that continues to evolve and change. Certainly when we look at options that from at home, dialysis at home, that's becoming a bigger thing. And, all of those, there's a lot of different technology opportunities that are coming to bear. AI, we're seeing that sort of take shape. I look at that for our frontline field clinicians, and right now they take forever to have to type out notes, and now they're able to speak that, and in some ways, future vision, that'll be interpreted for any gaps that they miss or things that it can pick that up, which is really cool. One thing I was thinking about is just the up close personal nature, for example, and over time, I've heard some of our nurses who've relayed that when they were much in the industry earlier, they would take their kids to the home with them to meet the patients, and they love that. Now there's a lot of guidelines around HIPAA and privacy and security, and all of that is great in terms of patients having that security and the privacy. But again, there's a double-edged sword to that on some level, where those regulations can they craft for intended good, but can kind of create some of that as well. Quality outcomes. I know regulation right now, even in the political environment, there's a drive to pull some of that back, which I think is warranted. But there's also, with those regulations, there's, I think, an intent on quality care for our patients, on ensuring that those outcomes are there, that we can measure that we can actually show the effectiveness of what we are doing. But as with anyway, there's kind of this dual side with most everything. But that's just a few examples of kind of broader things that have changed over time.
I I couldn't agree more with all of your points. I think AI will definitely help our industry. I think unfortunately it's getting some bad press right now because it's kind of being used in not so great ways on the insurance side with denials and that sort of thing. And so our industry and the healthcare side, we've got to catch up with that because the administrative burden really is interfering with patient care, in my opinion. And so that it's like both sides.
It is.
Like everything, it has goods and bads. Like you just mentioned with the whole HIPAA thing, it's needed, but does it interfere with some, I mean, if you ask that patient whether they want those kids to be there, they'd be like, yeah, bring the kids
bring
on,
them over. That makes my day.
But I definitely feel like there's lots and lots of goods and bads both. But I agree, technology is something that I'm very hopeful that will continue to help bring it closer. And I also agree that allocation of resources, we do have to keep it streamlined as much as we can, and so that the people that need it really do get the best of it.
Exactly.
I just don't want the baby thrown out with the bathwater, so to speak, in the midst of them trying to make cuts that too quickly without really seeing what the impact might be to the community as a whole. So let me shift to hospitals in general. This is more kind of your opinion on things or your point of view on it, but there are a lot of rural hospitals that we hear about are closing throughout the United States. There's a lot of concerns with some of these cuts that we just mentioned that's going to strain those systems more, and rural health especially, since we're tied so closely with rural health down here. It's always a concern. In your opinion, what do you think are the biggest, I guess, challenges for those rural communities that have these hospital systems, and what maybe can be done about it? I'm not sure.
Yeah, no, I appreciate that. I think that's a good question. And you're right, for those rural, it seems almost ironic that we talk about those rural areas that are always kind of in those challenging, and when they need it the most, they're so a little bit isolated and not always have access to those same resources. But I think from a CoxHealth perspective, certainly that commitment to our rural communities has been extremely clear. And we've got really strong rural hospitals in Branson and in Monette and in Barton County, where that collaboration with the mothership, so to speak, back in Springfield has created really strong partnerships there. And so those areas have been able to do really well. And I think certainly the challenges with volumes, with having adequate staffing, with providers that can provide the care, those are real challenges. But I'm proud to say Cox, I think, has done really well with that. But there's also opportunities, collaboration, the way that we're working with, for example, CMH in Bolivar or OCH down in West Plains. They're critical areas. And so some of that's just learning together, leaning together, and doing all that we can to make sure those are continued.
When you look at a map of income by county, we have some of the poorest counties by far in the state of Missouri. And so some of these rural hospitals rely heavily on Medicaid. Are there any concerns about Medicaid being cut for some of these individuals?
I think certainly, the landscape, there's some uncertainty with what's happening with Medicaid. So that is definitely something to continue to watch. I think partnering with the legislators, we've had a lot of conversations there, working together. And I think there's also a real side of that where there's only so many resources to go around, like you had said. So how do we navigate that together where the resources are being good stewards of those resources, as we kind of mentioned, looking at how we can be most efficient with what we're doing, but then also continuing to monitor that going forward. So there's not a super great way to address that right now, I don't think, because we just have to be able to evolve and work with as we move forward.
It's going to be interesting. This next year is going to be very, very interesting to see. So you have to lead a lot of teams, and You do an amazing job. I've met some of your team, and that they're incredible people. How do you balance the compassion with the efficiency of, because I mean, it's a business like you just like any other business. We have to stay as efficient as we can.
Yep, that's a challenge for sure. And I think kind of to your point about the team members, first of all, is hiring for right people, right spot. They do amazing work, and that compassion has to be there first. We can teach all the other things, but that's the core. And typically, if we're trying to do the right thing, the right time by patients, the rest kind of falls in line for the most part. However, certainly we have to be good stewards of contracting of resources. With rates that we're looking at supplies, are we doing that in the most proper way, getting good supplies for patients, but also making sure those costs are where we need them to be? We look at certainly at the resources that we're giving to our employees. For example, I'd mentioned the AI and how they're able to be as efficient as they possibly can when they're going in, and that gives them their time back as well. Good metrics. We watch all kinds of metrics to, where is that, trying to manage by numbers to just not off field. There's been opportunities or times where I guess that's your heart kind of drives and you have to back up. Okay, let's just look at how are we actually operating within that. So it is a balance though, and it's trying to make the best decisions that we can based on what we know and what we see coming and the resources that we do have. So one of the ones that have been really come to light most recently is the work being done with the Alliance. And you and I have talked about that before as well. But that ensuring the career and pipeline for future healthcare also, that's part of that vision, and being good stewards while making sure that we can continue into the future. So they've done a great job of partnering within the community with Springfield Public Schools and with MSU and OTC and Evangel, and the list keeps growing to create good pathways and partnership for those students to be able to have that path forward. So that's really exciting. We're seeing partnership with pediatrics to bring that to our region in a whole different way. Right now, there's a gap there. And so being able to work through that, and how do we make sure that those families who need it most are able to access those services here. And so that's been definitely community driven. You mentioned like the soft surrender being part of those things so that we can bring those services to light and, highlight what it is that's we do within the community. We're required to do volunteer hours so that we're giving back to our communities. We find where our passions lie and make sure that we are giving back as well. Most recently, one that I really love, this is a kind of on the scheme of thing, a smaller, but for our hospice families, a partnership with Nathaniel Green, for example, so that we have a space for those families to go and have memorials and to actually create bricks and things for families where they can go and have a place that's part of our community, but also part of the team. So things like that, we just try really hard to stay in front of. And I think the culture, back to that local that we talked about pretty early on, we live, we breathe, we're in our communities, and that is very alive in the culture that we have.
I'm not sure a lot of our listeners know what the Alliance is.
So that Alliance, it's the partnership where those schools collaboratively are coming together to create a whole new vision for care, where they can work with classes between them, where it's streamlined funding the way that they're talking to students early on. So my daughter, for example, she started out at OTC. She wants to do radiography. So now some of her classes are with MSU, and then she'll circle back to OTC as well. So it's just this really different partnership.
Okay.
So the Missouri Alliance for Care at Home, yes, I am on the board for that. So, and that's an agency that advocates legislatively for through the National Alliance for Home Care. They're part of that as well, where agencies across the state sort of partner together. What are concerns? How do we work together to bring insight to initiatives? How do we educate each other? And so that's a great organization across the state. And Carol Hudspeth does that. And
Yes.
that advocacy where they're, making sure that legislators understand about impacts as they're talking about rates and how they're setting things for the final rule in home health and all of that. So they do great work.
So I'm sure in your role within your family, you're like the expert, everything healthcare, right? And they probably come to you and ask you a lot of questions. What are some of the things that you give advice to your own family?
Lots of, I think some of what I share with my dad, that was through this service is available and that sort of thing. I try really hard not to, and this is probably okay or not okay, I don't really push our services specifically. I push, know what your options are and do what is good for you. Because for every family, you may have a connection. When it's time for a hospice nurse, that may be a Haven nurse who they know and want, and that's okay. Maybe a CoxHealth at home nurse, that may be something else. So that's all right. You don't have to be tied to. I think it's okay to question everything. And I do strongly advocate for that. If you don't understand, that is okay. It's okay to ask, and you should. Because there's a lot of times where we think that a payer is going to work this way, or this plan is going to work this way, or this program, and it is impossible. I would say truly impossible to know the ins and outs of all of that. Even as the expert, I don't know all of that. You may, but
I don't.
But
I definitely don't.
Yeah. So it's just highly complicated. So I think it's okay to slow it down and ask. That's probably the biggest advice that I give.
For sure. That's great advice. So we covered a lot of information, tons of information. So Paul, if you were to say, if somebody were listening to this podcast, what was one of the biggest takeaways from this? What would that be?
And obviously I'm passionate about home care. There's all the services in the hospital that are amazing. And also nothing to take away from that. But when there is a need at home, no matter what that is, there is probably an avenue to get that taken care of. And there's lots of different options for people at the end of life care, as far as just care along the way. But probably we have something that can help keep you at home, even if that's a little longer, or to help support a family member, what have you. So I think that's probably the biggest takeaway I'd have. If you have a need, let us help. We can probably find something to get there. So
good. Let me touch on a couple of things before we close completely, because I want to make sure we touch on it. CoxHealth at Home's holistic suite of services, home health, in-home support, hospice equipment, therapy. Of those things that you bring together, to bear, is there one person within the organization that's coordinating all of it, or is it just it's a referral as needed type thing?
Yeah. So within each program, there are directors that are overseeing those rules, regulation, guidelines. From a patient standpoint, though, when they're coming in, we have a central intake area that normally those initial needs, they're helping to assess that and determine where's the starting point. Certainly if a physician's ordered home health, that's the starting point. And then, you may identify up front that this could also be an option. This could also be an option. We rely really heavily on our teams that are out in the front, that are in the homes, that are talking to patients, because there's phone assessment with an intake person may not catch that, okay, I'm in the home and now I have food disparity, and that's a real need for me. So, but the frontline workers do catch that. And so then they can call back in and talk to an intake or talk to their supervisor or whoever, and then we can start that referral process. That is something that we work on all the time, though, because even something that one individual might see as a need, someone else might not. And so that's something that we work all the time on: education and how do you know what you're looking for? How do we know that we're meeting those patients' needs? And a lot of times they'll just tell us. But it takes a whole team to identify those needs, even for each patient. Yeah.
Yeah, it is one of the larger challenges, because I think some people feel like every person who walks through their door knows all of the things.
Yeah.
And there are so many things, it's impossible for them to know it all.
Right.
And, I'm a physical therapist, so I'm walking through the door and I'm looking at very specific things that are related to physical therapy,
Exactly.
and sometimes it's easy to miss things that would be obvious to a nurse or, a social worker or that sort of thing. And that, I think, is where I think educating the general public about what they should expect with care, the level of care. And this is kind of going off a little bit in a different direction, but, one of the things that we're really trying to educate people on is what should they expect? And, and it seems almost granular to get into the weeds too much, but like how long a visit should be if they're being seen by someone in home health or hospice, for instance. And I know it varies a lot, but there's kind of basics that, are kind of every agency should do, every hospice should do, every, fill in the blank. Are there things like if you were to say, you're on the phone with your family member and they're saying, hey, I'm just starting on home health. They live 2 states away or something like that. And you're trying to go, how, are they getting good care? And you're trying to assess that. What are some of the things you might be asking or telling them to look for?
Yeah, certainly. That identification up front. So that's, to me, when you're in your home and you have individuals coming in, whether that's a therapist or a nurse or an aide, or sometimes multiple, asking for clear, who are you? What? So we should always be disclosing, what are we there for? Why are we there? I think that's important. Length of visits. Most of the time, 45 minutes to an hour is pretty standard. If somebody's in and out in 10 minutes, there could be some flags there. Let them know what that looks like. Certainly the respect and dignity always. How are you being treated? And is someone respectful of what it is? We're in their home. And that's one of, I think, the absolute privileges that we have, is that we're being welcomed in, part of that family, part of their environment where their dog and their lives and their memories are there. So we need to be respectful of that always. And if you have a team member that's not, they should be letting someone know that.
Yeah.
I think that's really, really critical. And then a good care plan, you should know, here's what I'm here to accomplish today. So if that's an aide, I'm here to do your bath. I'm here to do your shopping. If I'm a nurse, I'm here to take your vitals. I'm here to your therapy, whatever. We need to be really transparent and clear about what our purpose is and being responsive to patients' needs. Those are a few things off the top I can think
amazing.
of.
I love everything you just said. I think some people are afraid to call and complain for a variety of reasons. They don't want to get somebody in trouble, or maybe they're worried that person's going to be upset with them because they don't want to rock the boat. They rely on that person coming into the home.
Yeah.
How would you reassure someone that if they did call and say, I don't know if this is the way it's supposed to be, that agency is there to protect them?
Yeah. I love that question, because I think you're right. People are afraid. That we hear that a lot. They caregivers or whoever is very close to them, they don't want to get anybody in trouble. And so my advice would be, one, call and discuss. We can't fix anything if we don't know. So we want to talk. And maybe there is a reason, or sometimes it's just not a good match. I don't know, John, maybe you and I we're just not connecting, and that's okay. So let us know that, and we can assign John to someone else or Kim to someone else. And maybe that would be a better match. But I think we owe it to our patients to be responsive to that, to listen without judgment. Sometimes you just have a perception that maybe, or we can help reassure that this is something that, here's what this visit should look like. Here's what those care plans, and we navigate that together. So open door always. And I would say, if you're a patient or a client that's called in and you get anything but let me help you, then that in itself is a red flag.
Right. Absolutely.
Yeah.
I think sometimes the person might be like, well, it doesn't bother me. But oftentimes I'll tell those same people who have concerns that you're not only helping you, we're looking for trends in care.
Exactly.
And we're looking for burnout in caregivers. And that's not to say they're bad people at all. And they may just need additional support. And that agency should be there to help them support. And if we can't identify those signs, because sometimes they don't even see it in themselves.
Exactly.
They can help with that and to ensure that other patients that are on that person's caseload aren't experiencing the same thing. So if somebody complains, we don't typically take that one off as like, if this is who this employee is. I mean, oftentimes we're trying to check in with other patients and say, what are you experiencing? Are you seeing anything? And then sitting down with that employee and just saying, what's going on? Like, are you okay? Is everything, functioning? We try not to take it from a, an accusation standpoint, but really from a, how do we care for our caregivers and serve them as well?
Yeah, you're right. It's both sides of that for sure. Advocacy.
So with caregiver burnout, and that it runs rampant in healthcare. There's not enough healthcare workers to go around for all the patients. Day in and day out, it can be very mentally straining and stressful. What things does Cox do to support their employees?
Yeah. So first of all, I think part of the initial is just flexibility. We really work with employees on what works for you. And some areas are a little more flexible than others in terms of shifts and things like that. But the home care side specifically, if I am single mom and I need to meet my kiddo off the bus at 3 p.m., we can typically make arrangements for that to happen. Those things help with the burnout. Those things help with making sure that we're having those buckets filled. Cox has a really great employee assistance program as well, and that includes things like Modern Health, for example. So our employees have access to counseling sessions. I believe it's 5 a year that you can do, and that's for your dependents as well, and life coaching. I had a hospice director not too long ago. She tapped into that. And at the end of those sessions, her calling was to move to Boston. She worked with her life coach, and that's where she went. Her family had moved on, and they're like, why are you here? And so it's those kind of things where I think CoxHealth has been really intentional to provide outlets, to provide support. And then I think some of it's back to that culture we were just talking about, that you were just mentioning about being there for our patients, but also our employees. There are times where our employees just need to, we wear all kinds of hats as counselors, as mentors, as friends sometimes. And so it's okay to come in and, hey, I need this issue, or I'm not feeling great about this. And we walk through those things. So I think it's all about culture.
Well, I have to say that Cox is so lucky to have you.
Well, thanks. Vice versa.
Yeah, well, and I really feel like you're in the right place for sure, and this community benefits from it as well.
So Kim, I got to ask, what is the most inspiring thing about your job?
There's a lot of inspiring things, but I am a people girl, and I love the employees that provide the care. I think they're incredible. They come, very rarely do we hear someone that says, I'm here for just a job. They're here because they want to make a difference for people. So it's not super often that your passion and a meaningful day can come together like that in a job fashion. And so that happens for me every day. And then kind of back to what I was talking about with the impact that we have for families in their home. We are in their very intimate space. And so we become a part of that. Their families, a part of them, and those relationships and the impact that we're able to make there is absolutely unmatched anywhere. So those things certainly inspire, and it is just never a dull moment. It's changing constantly. I learn every day. And so all of that just keeps me going every morning. So I love it. I love it.
That's fantastic.
Yeah, that's amazing. I really feel like you're in the right place for sure, and this community benefits from it as well. So thank you so much for that. And thank you for being on the show.
Thank you. I love this and appreciate being here. So thank you.
I have to say, I love Kim Sisk. I've known her for a very long time. We've crossed paths so many times. And not only is she in charge of a huge organization with Cox at Home and all of the working parts, she's just a really nice person, very down to earth. And, I've always liked her as a person, but she really does have, she wants to support her team and she wants to make sure that they do it right. And I think Cox at Home and Cox Health System in general has really helped support her and all the ways that she advocates for the patients and for home care in general. I'm a huge fan.
Absolutely. I love her passion. She's so passionate about what she does, and she's so informative. I mean, she's able to like take really difficult issues and just break it down for your average person, and just like, okay, no, this is what you should do in this situation, or no, you don't want hospice, you want palliative care or whatever. And that's what I loved about it, is just really breaking down some of the tough things that just helped me to understand some of the issues and how to deal with them.
The other thing is her personal family, the things that they've been through. It just shows you that everyone has these
story.
issues. Everyone
Yeah.
deals with some sort of elder care at some point, and it's just, she even in her position still had to, run the gauntlet a little bit to try to make sure that she got the care that her mom needed. And all of these services come to bear for her dad. And I love to see, how that the business of healthcare actually helps the personal of your life. And I think understanding all of these services are out there. I think it'll really help families, and just really making sure that they understand that even as things unfold, sometimes they don't unfold the way we want them to, and that families really can advocate to get the best care. And I'm really glad that Kim's in the position that she's in to make sure that this community has great services.
Absolutely. We got to have her back, because she just has so much knowledge, and she just makes everything so much easier to understand.
Absolutely.
If you enjoyed today's conversation, make sure to like and subscribe so you never miss an episode.
And we'd love to stay connected. Follow us on YouTube, Facebook, and on Instagram at In Good Company Elder Care Podcast.
You can also find us on X, formerly known as Twitter, at IGC Pod, and on TikTok at IGC Elder Care Podcast.
Thanks for tuning in to In Good Company Elder Care in Your Backyard. I'm John Ray, and I've been joined by my amazing co-host, Spencer Ernst. Special thanks to our executive producer, Alex Wallace, for helping bring this show to life. Until next time, take care, and remember, you are always in good company.